everyone, good to see you again. My name's Heather. I'll be your nurse practitioner seeing you today. How you feeling?
Good.
Good. We're just gonna do, we kind of went through some assessment questions already, but we're just gonna do a typical head, neck, ears, eyes, throat assessment today. Okay, so just lots of questions, and I'll be doing a few different tests on you. Okay?
All right.
Okay. So first I'm going to look at you, just overall, your body well kept. If you are well bathed, there's no body odors, there's no smells of infection or any odd types of things like that. So that's what I'm looking for. Everything looks good, you look clean, well kept. I'm looking for symmetry, the eyes level, your mouth when you smile. Can you smile for me and raise your eyebrows for me? Thank you. Everything looks good, nice, symmetrical. I'm looking at his neck to make sure we don't have any extra skin folds or any webbing, abnormal things that can indicate some congenital abnormalities. And then I'm going to check his skin turgor and make sure that you don't have any tinting, you are well hydrated, healthy, good skin elasticity, not too dry. Your eyes look nice and bright. You don't look yellow, jaundice. I can pull down. I would have gloves on, but you're family, so nice and pink. And your sclera nice and white, nice and bright, and look well hydrated. You do not look dry. And then I'm going to check your scalp. It should be nice and mobile. There should be no, I'm looking for infestations, I'm looking for strange moles, any redness, infection, any lumps, bumps, bruises. I would ask you questions previously of any head injuries or anything odd like that you've had in the past. And I'm looking for hair distribution also. Kind of like not for any bald spots. You have some male pattern baldness, which just typical and symmetrical, but otherwise hair on your arms, your head, everything looks normal. Facial hair is well kept, and I don't see any bald spots or anything. I'm going to check your fingernails. We should see no signs of infection, redness around the nail beds. Nails should be nicely attached. Not being attached could indicate some nail fungus or infection under there. I'm going to check for clubbing, and a good way to check this is, can you put your two thumbs together for me? I should see a nice triangle of space there. Correct. Yep, looks great. No signs of clubbing. You have no tremors. Everything looks good. Can you just squeeze my hands? Yep, and pull back. Yep, good. Nice symmetrical strength there. No signs of infection, no drainage, no warts, and no fungus. And then I'm going to check your neck for, maybe let's just check some mobility. You can look up towards the ceiling and tell me if you have any pain or discomfort with any of this or stiffness. And down, and to the left, to the right. Okay, any troubles there moving?
No.
Nope. Okay. No cracking or nothing like that?
Nothing.
Okay. I'm gonna look at your trachea, make sure that it's midline. I don't see any bumps like large lymph nodes, anything like that. I'm going to palpate your thyroid, and I'm gonna step behind you to do that, okay? I'm gonna feel for the cricoid process, the first big lump there, and then palpate over to the sides and use my about 3 fingers to really feel if I feel any abnormal tissue there of the thyroid, but I don't. I just feel nice midline trachea. I'd like you to swallow for me and see if I can feel any abnormal tissue. Nope, it feels good. No enlarged lymph nodes. Okay. And then I'm gonna feel your lymph nodes. So here in the front with a few fingers, 3 fingers, I'm gonna pre-auricle lymph nodes, post-auricle lymph nodes, occipital lymph nodes back here at the occipital bones, and then sternocleidomastoid, submandibular, submental, anterior deep, which you cannot usually feel. I shouldn't really be feeling any of these lymph nodes. Maybe just small, soft, round. Anything firm could indicate malignancy, or even like just infection process. If you did have something enlarged, I would ask you, have you been sick? Have you had maybe any ear pain, anything going on recently? And then we do some further testing if there was concerns. And then I am going to listen for bruits. You just close your eyes for me. Listen over the eyes. Temporal. And then over the thyroid process. And I don't hear anything. Sounds good. I'm going to check your eyes, okay? I just want you to look straight ahead of me, and I'm going to check for accommodation. I want you to just follow this light. And both eyes come in towards his nose. He gets cross-eyed, which is normal, what we want to see, okay? And then I want you to look straight at me, and then just, I'm sorry, not straight at me. Look at the light here, and you're just going to follow this. I'm going to check your cardinal fields of vision. Okay, good. And I'm going to check your pupillary response. So if you can just look at me, I'm going to shine the bright light and just watch for pupil constriction. 3, that was round, equal, brisk. 3, round, equal, brisk. Nice. Your eyes are nice. Your conjunctiva is nice and sclera, I'm sorry, is nice and white. I don't see any drainage, no tear duct inflammation. Your eyelashes look good and normal. No missing hair. Looks good. Okay, and then I'm going to check your vision. We have a Snellen eye chart back here, 10 foot back from it, and you're just going to cover one eye and read the bottom line for me.
LTFPH.
Okay, good job. And then we would check the other eye, of course, but just for time's sake, we're just going to do one. I'm going to check for confrontation, kind of check your vision field. I want you to cover your left eye, and I'm going to close my left eye, and I'm just going to hold up fingers, and you're just going to tell me how many fingers you see, okay?
2, 1, 3, 2, 2.
Okay, and then we would check the other eye. And then I'm going to check with the ophthalmoscope, the lens of your eye, and everything inside, and see what I would dim the lights if needed. Right eye, right hand up to your right eye, and I'm looking for the red reflux, and that looks good. You can see the arteries are a little bit larger than the veins. Iris is nice and round. No wool spots. Everything looks really good in there. And I checked the other eye, of course. Macula, everything looked really good. I'm gonna then move on to your ears. I always have this fear that we're not recording. We're at 9 minutes. So I'm gonna palpate your ears, and you tell me if you feel any tenderness. I'm looking for bumps, any drainage, any pain, pain when I'm touching your ears. And I would kind of pull on them a little bit too and see if there's any pain down in the deep ear. Change this. Okay, just kind of look in your ear here, and I'm looking in the ear canal. Should be nice and clean. Should see a little bit of hair in there. I don't see any wax build up. I can visualize the cone of light on your tympanic membrane. It looks nice. I can see the bones in there. Nice pearly, clearish, no drainage, no perforations, no abnormal swelling of the ear canal. It looks great in there. Any pain when nope, okay. And then I'm going to check your hearing with a couple little tests, okay? This Weber test, I'm going to put this on your forehead, and you should hear this to both ears, okay? Kind of like a humming noise. You just tell me if you can hear it in both ears or if you're having trouble and it's only in one ear.
I can hear.
Both ears?
Yep.
Okay, thank you. And then another test, a Renee test, is going to check bone and air conduction hearing. So I'm going to put this behind your ear and then right in front of your ear. And you're just going to tell me when you don't hear the humming anymore.
I don't think it did it.
I was wondering, I felt like I didn't. Okay.
I don't hear it. Don't hear it.
Okay. So air should be 2 times longer than bone conduction. So that was pretty good. We're gonna do another hearing test, okay? So I'm gonna whisper. You're gonna occlude one ear. Can you just occlude your right ear for me? And then I'm gonna stand about 6 feet away, and then I'm gonna whisper something, and you're just gonna repeat what you hear, okay?
All right. Computer.
And I'm gonna do that 3 times in each ear, so then you can cover the other ear, and we'll do another whisper test in that ear. Good job. Okay. And then I'm gonna take a look at your nose. I'm looking first, just everything's midline, straight. Your nares look a little bit abnormal. Did you have a little childhood injury there?
Yep.
So you had some stitches, you told me, over there, right?
Yep.
On one side of your nose, you'd fallen and hitting a table, and you kind of had some snoring difficulties since. So let's see what your nose looks like up there. I'm looking at the turbinates, nice and pink symptom there. A little bit abnormally red, but you said you take some allergy meds.
When needed, yeah.
When needed, yeah. No polyps or abnormal swelling. Everything looks pretty normal. No extra, just a little bit of normal mucus, nothing major. Can you occlude one side of your nose and breathe in for me? Any trouble? I don't hear any wheezing or anything. Sounds like good airflow. And then do the other side. Good?
Yep.
Okay. And then your mouth. So first I'm just going to look at the outside. Lips are nice and pink. They don't look overly dry. They look good. So smile for me. I'd like to see your teeth. Are you having any issues with your teeth at all? Any cavities or regular routine dental care? Okay. And then open up and stick your tongue out for me. I'm looking for symmetry. I'm looking for any swelling, bumps, any like unkept hygiene type of stuff. Okay, you can put your tongue back in. Are your gums tender? Any pain in your mouth? No? Okay, and then I just want to take a look at the back of your throat, your tonsils. Okay, those look good, a little bit enlarged. And I would check your gag reflex. And yes, gag reflex is intact. You have a good gag reflex. Gums are pink, mouth looks good. No concerns there. Okay. Thank you.